Good afternoon. I'm Greg Hart, Chair of the Santa Barbara County Board of Supervisors. This press conference is broadcasting on County TV Channel 20 and the county's YouTube page. The meeting is being interpreted in American Sign Language by Julia Townsend. Carlos Saracito is interpreting this press conference in Spanish. His interpretation will be available on the county's website and YouTube page shortly after we conclude this press conference. We've had some very good news over the past month. Local cases and hospitalizations have declined dramatically, and we've moved from the purple to the red tier. At this pivotal moment, while we are experiencing success in battling the coronavirus pandemic in most of California and in Santa Barbara County, it's also very important to recognize how difficult and different the circumstances are regarding COVID-19 around the country and the world. The COVID-19 pandemic is currently out of control in Wisconsin. Those are the words used by Wisconsin Governor Tony Evers 2 days ago. In response, the governor has activated a field hospital as the surge in COVID-19 cases threatens to overwhelm hospitals. In just 1 month, the number of COVID-19 cases in Wisconsin has tripled. Flare-ups of coronavirus cases in New York City neighborhoods has forced Governor Cuomo to begin reintroducing restrictions on businesses to protect public health. In August and September, too many New Yorkers grew more lax and less vigilant about physical distancing and wearing masks. The result is increasing COVID-19 outbreaks that seriously threaten the progress New York City had achieved since the first wave of the virus receded. The troubling situation in Wisconsin and New York is not unique. Today, 35 states are experiencing escalating cases of COVID-19. 12 of those states are currently experiencing unchecked spread of COVID-19. In California this week, increasing cases caused Tehama County to move backwards from the red to the purple tier and Shasta County to move backwards from the orange to the red tier. Looking across the Atlantic Ocean to Europe, the Spanish government has now declared a state of emergency to keep Madrid in partial lockdown. The limited lockdown ordered by the Spanish government a week ago bans all non-essential travel in and out of the confined areas. German Chancellor Angela Merkel announced the coming days and weeks will decide how Germany gets through the epidemic this winter. If the infection rate in Germany does not stabilize in 10 days, further targeted restrictions are unavoidable in order to further reduce public contacts. In France, which reported more than 18,000 new cases on Thursday, almost 25% of intensive care unit beds are now occupied by COVID-19 patients. The figure rises to 40% in the Paris region. Clearly, the COVID-19 global pandemic is far from over. Fortunately, Santa Barbara County is currently in a good place. Our county remains in the red tier because our local residents are taking public health guidance seriously. This progress is very fragile, however. As we can see from other parts of the United States and countries around the world, complacency will bring the virus back very quickly. And if that occurs, Governor Newsom's public health order will require some businesses to close down again if we go backwards to the purple tier. Right now, we have an opportunity to learn from the mistakes others have made in the course of the pandemic and to not repeat them. Public health officials across the globe are saying the same thing. The second wave of the virus is caused by people getting careless and dropping their guard. Whether it's from a sense of fatigue because this has been going on for so long, carelessness, or ideological opposition to simple common sense public health practices, the result is the same. If people stop wearing masks and practicing physical distancing, the virus will spread again. It's happening everywhere, and we are not immune. We must continue to look out for each other and do everything we can to keep the virus in decline. Please to continue to wear your mask at all times when you could come in contact with other people. Continue to reduce contacts and keep 6 feet of separation at all times. Wash your hands thoroughly and slow down. Be careful and plan ahead. Being rushed increases the opportunity for mistakes. If we stay vigilant and attentive, we can stay on the decreasing path and move forward into the less restrictive orange tier. There, more businesses will have more opportunities to reopen indoor services. Most importantly, we will be avoiding the devastating public health consequences of a second wave of the virus. The choice is ours together. Next, we have Dr. Reynosso, Director of the county's Department of Public Health.
Thank you, Supervisor Hart, for sharing the transmission of COVID-19 in other states and countries. Here in Santa Barbara County, on Tuesday, along with the 5.8 adjusted case rate and the 3.3 testing positivity rate, the state also posted the new health equity metric for our county at 6.7. These metrics are indications of how much the virus is spreading in our communities. With the health equity metric, we are given the opportunity to look closely at neighborhoods identified by the state to ensure they do not carry a larger burden of illness than their neighbors. In order for us to move into the less restrictive orange tier, we will need to decrease our adjusted case rate to be at or below 3.0 or no more than an average of 17 new cases for our county population per day. Additionally, we need to continue to ensure that our test positivity is at or below 4.9%. We've done well in our county-wide testing positivity rate, but we will need to decrease the testing positivity rate in neighborhoods identified by the state for the health equity metric. Here are 3 important things to know about the new health equity metric. 1, it is designed to acknowledge and address the impact of COVID on low-income communities and communities of color throughout the state and locally. The county's overall test positivity rate is compared with the testing positivity rate in the county's census tracts with the least opportunities for good health outcomes. The state is acknowledging the importance of addressing the disproportionate impact and toll this virus has on low-income and communities of color throughout California, particularly our Black, Latinx, Indigenous, and Native Hawaiian and Pacific Islander community members. 2, the health equity metric recognizes the importance of targeting investments in communities that are disproportionately impacted by the virus to address structural inequities that require both short and long-term solutions. Achieving equity during this unprecedented pandemic in the short and long term means prioritizing equity in our response and recovery. In the short term, it means focusing on strategies and policy changes that address the immediate drivers of COVID-19 disparities, such as access to testing, culturally and linguistically appropriate contact tracing, quarantine and isolation housing for individuals and their families when needed, ensuring a safe workplace. We are working diligently with trusted community partners to meet all of these requirements and will continue to aggressively do so. 3, the equity metric builds on efforts to provide all Californians access to COVID-19 testing, education, and supports, particularly for individuals in communities that are disproportionately impacted to help reduce the transmission of the virus. As a county and as a public health department, health equity is part of the values that we live and work to practice every day. We are here to serve the whole community and recognize the importance and necessity of outreaching to vulnerable populations both prior to COVID-19 pandemic response and throughout it. The equity metric reinforces and provides enhanced opportunity to continue to work with our community to ensure that their needs are met and we as a whole can reduce disease transmission and remain safely and healthy. We will therefore redouble our county's efforts with our partners to serve individuals in communities that are disproportionately impacted. Achieving health equity means critical partnerships. Local health departments, across government partners, healthcare providers, the business community, community partners and leaders, and community members. We all need to have a shared goal of ensuring that all community members in the Santa Barbara County will have equal opportunities for optimal health, mental health, and well-being, especially during COVID-19. With regards to access to testing mentioned in previous press conferences, we now have expanded our testing capacity in Isla Vista. We have at least 3 testing events planned, starting with one today. Our county team is currently in IV, and we know that at least 100 community members will be tested today. Our next testing events in IV will be on October 23rd and November 6th, and we are currently looking into more dates. Also, I'd like to give a quick update on our drive-through flu shot clinics. On Tuesday and Wednesday, we gave over 1,100 free flu shots to residents in Lompoc. We were at San Marcos High School yesterday and are there currently, where we anticipate providing 1,200 flu shots. We will be at the Allen Hancock College on October 13th and 15th. I want to encourage all members of our community to get their flu shots. It is widely available throughout our county. It is critically important prevention to safeguard you and your family, especially during this COVID-19 pandemic. Lastly, a reminder to not gather. Our common goal is to reduce our case rates and decrease testing positivity. However, in the last several days, Santa Barbara County experienced an uptick in cases and testing positivity during this current tier assignment. We must decrease the spread of COVID-19 in our community. We want to continue the progress we've made so far so that our community is seeing less disease transmission. We want to keep the business sectors open and schools to have the opportunity to start in-person learning. We know from the work of our contact tracers and interviews that gathering of all types continue to increase case rates and positivity. So please limit mixing with those outside your household. Thank you for your partnership in curtailing the spread of COVID-19 in our community.
Thank you, Dr. Reynosso. Dr. Henning Ansorg, the county's public health officer, is also here with us today.
Thank you, Supervisor Hart. Good afternoon, everyone. We determine how widespread the coronavirus still is in our community by looking at our daily new case rates and test positivity percentages. The downward trend for the past few weeks unfortunately experienced a recent uptick that was in part related to an outbreak at a skilled nursing facility and in part due to reduced vigilance with mask wearing and social distancing. Everybody, please understand that opening up businesses does not mean that mask wearing and social distancing has become unnecessary or optional. In fact, quite the opposite is necessary. The more people are out and about, the more important these measures actually are. They are the only way to keep infection rates down. The CDC now acknowledges that the coronavirus is airborne. It has the capacity to stay suspended in the air for a little while. It can travel even farther than 6 feet and still be contagious. Every infected person, whether they are sick or remaining asymptomatic, on average infect 2 to 4 additional people. About 8% of cases unknowingly become so-called super spreaders and cause about 60% of all infections. The only proven way to stay protected while the virus is still widespread in the area is to always keep a safe distance, wear a mask, and avoid crowds and gatherings. One of our skilled nursing facilities in Santa Maria experienced a significant outbreak of COVID over the last 1.5 weeks. Our public health, medical operations, and disease control teams are collaborating with the facility to manage this outbreak, to improve infection control protocols, and together with the state agencies, help to secure appropriate staffing needs. One resident had to be hospitalized briefly, and unfortunately, one resident died. We know that most of our community members are taking our recommendations and guidelines very seriously. I want to thank you for that. Because of their commitment, we are reducing the spread of the virus locally, and we will be able to open K-12 schools, possibly as soon as next week. If we continue on a downward trend, we are poised to reach the next less restrictive tier, which will put us in a position to open more businesses. Please understand that industry sectors can only remain open as long as we maintain or reduce the current level of new infections. If we were to experience a resurgence in cases, we would have to then shut businesses down again. This now is the time where we have to remind ourselves to continue with our proven mitigation efforts. Thank you for your cooperation.
Thank you, Dr. Anzard. I'm very pleased that Pastor Denise Leichter from the Community of Christ in Santa Barbara has joined us today to share ways our faith communities are keeping safe during this difficult time. Welcome, Pastor Leichter.
Thank you, Supervisor Hart. I'm also with you today as a representative of the Greater Santa Barbara Clergy Association. And we are grateful to be part of a county that is making progress through the COVID-19 virus tiers. And I am here to encourage our communities to stay vigilant with the standards for wearing masks and managing the physical distancing of 6 feet or greater. Many of our faith traditions were thrust into wilderness wandering some months ago, but we're now utilizing courageous and creative ways to gather for worship, for study, and to do membership check-ins for well-being, all coming through online technologies. Some are starting back to in-person outside, and others are tenderly beginning to cross the thresholds back into buildings and community services. The intersectionality over these next few months for businesses, schools, health systems preparing for flu season, fire or smoke challenges, Halloween, voting, and faith facilities that choose to gather in person and inside require a faithful response to the county guidelines. This is the season for eating and singing and chanting in gratitude and with great celebration. But this year, it needs to be different. Masks, physical distancing, 25% capacity in our buildings, no shared food banquet tables, no singing inside, fulfill the mandates of the state and county and can keep this community safe while protecting the most vulnerable. We can do this right in new ways, and every faith tradition has a scriptural direction to love thy neighbor as thyself, for in their welfare resides our welfare. This is a universal truth that goes beyond traditional holiday planning and services. And when we do it right, we may progress into the next moderate to minimal cases and restrictions, and that will be the celebration. I'm honored to have a place and a voice at this table today, and the Clergy Association prayers go beyond risk management and are lifting up the community for patience, perseverance, compliance, hope, and blessings, that together we can turn every obstacle of COVID-19 into a new opportunity for sustainable health in our communities. Thank you.
Thank you, Pastor Leichter, for your thoughtful and inspiring words. We'll now go to questions from the room. Mr. Devine?
So first question for me, I guess I'll go to Dr. Reynosso. So talking about the new health equity metric, we were talking about communities that are disproportionately impacted. What neighborhoods are those in Santa Barbara County?
So those neighborhoods, there's about 21. We have 2 neighborhoods in Santa Barbara, 11 in Santa Maria, 1 in Guadalupe, 4 in Lompoc, 3 in Isla Vista. So these neighborhoods total 120,353 members.
And what do you guys specifically plan on doing with these 21 neighborhoods as far as the pandemic goes?
So it is an aggregate testing positivity rate. So we will continue to do the outreach, continue to do the testing availability in those neighborhoods, as well as continue to work on the isolation and quarantining availability. I think the opportunity here is now to partner with employers and business leaders so that we can affect change.
And another question for me, it could either be you or Greg, but when is the goal to get into the orange tier? Is it right on Halloween, right before Halloween, or?
We would like it to be as soon as possible, but realistically in 3 weeks.
Which would
So
be?
at around Halloween.
Okay.
Correct.
And then another question for Dr. Ansorg, talking about the skilled nursing facility outbreak in Santa Maria. Which skilled nursing facility was that?
Santa Maria post-acute.
And how many cases were recorded from that facility over the past week or so?
There were a total of 40 positive cases.
And are most of them recovering, or are they still active?
That's a very good question. Around 10 at least 10 have already fully recovered. And we are waiting testing results to clear the remainder out of isolation.
And lastly, when was the outbreak first realized and discovered?
The initial tests came back on September 25th. It was a staff person, and the rules in nursing homes are when a staff person tests positive, they get routinely tested for surveillance. Once a staff person is found to be positive, all staff and all residents get tested.
Okay.
And that's how the outbreak was identified.
Thank you.
Thank you, Mr. Devine. We'll now go to questions on the phone.
Yes, first up is Tom Bolton with Newshawk, to be followed by Laura Place with Santa Maria Times.
My first question is for Dr. Ansorg. The death reported today, was that from the congregate care facility in Santa Maria that you were just discussing?
My understanding is no, this death was a different resident.
Okay. And then I guess my next question is for Dr. Reynosso. When you talk about neighborhoods, can you just give us a little more understanding of that? Are these physical neighborhoods? Are these, groups of people in the sense of, racial characteristics or income level or what? Because it's not quite clear when we talk about a neighborhood.
Great question. So they're actually technically census tracts within a city. And so earlier, at an earlier interview, I used census tracts, and someone said, for the rest of us, neighborhoods work better. And so I have started to use neighborhoods, but technically, definition from the state is census tracts.
Okay, and so are they identified in terms of equity based on ethnicity, based on income level? How are they? Are they all identified the same way, or are there different ones based on different areas?
So they are throughout our county, and they are not necessarily based on ethnicity, but rather social conditions, physical conditions, such as poverty, such as level of education, housing density, transportation, access to health care, the physical environment. So there's actually 8 metrics that go into the overall methodology.
And these areas are showing significant rates of infection?
Correct. So it is 6.7 compared to the county overall of 3.3.
Okay. And I guess my last question, again, on the same topic, you went pretty quickly over the numbers, but just from the raw numbers, we know that a lot of those have been in the Santa Maria Valley, the rates of infection. And I'm wondering what specific strategies are being employed there to try to address that high rate of infection.
Sure. So we have, since the beginning, as soon as we realized that there was a disproportionate number of cases residing in that area, to partner up with a pretty comprehensive group of community partners. You may have heard that at the board presentation last Tuesday, but we partnered up with a wide variety of healthcare providers, community-based organizations, and community workers to make sure that the message about the prevention, about masking, about hand washing, about social distancing was heard, and heard in a language and in a manner that was acceptable and understood. So we have been on the forefront of doing that, and we continue to do that. And I think that when we compare the rates now with the rates at the beginning of the pandemic, we have seen a decrease. And I think that is attributable to the partnerships that we have formed on the Latinx and Indigenous Migrant COVID-19 Response Task Force. And as I mentioned earlier, I think our next opportunity is to make sure that we strengthen the partnership with employers and with business leaders and with other civic leaders to make sure that we're on the same page about decreasing the rates of transmission.
So it sounds like you feel like you've made progress, but is it safe to say that you feel there's still progress that needs to be made in that area?
I do see progress made, and I do realize that there are still opportunities to strengthen those partnerships. And I think that the efforts like what I just shared, the testing efforts in Isla Vista, is an example of an opportunity, a partnership with UCSB and other community members to make that happen. So that is an opportunity that we've been working on for the past 3 or 4 weeks and are realizing it.
Thank you all very much.
Thank you, Tom. Next up, we're going to Laura Place with Santa Maria Times. Go ahead, Laura.
Hi, can you all hear me okay?
We
Yes,
can.
we can.
Great. So my question is also about equity metrics. Can one of you give a little kind of context as to how you think meeting this metric and having to lower those rates in those specific communities will impact our rate of going into the orange tier? It sounds like there's a pretty big disparity between the case rates in those neighborhoods, much higher than the rest of the county. So, we've talked about going into the orange tier as soon as possible, but how do you see that impacting our rate of progression?
I think I think my takeaway with the health equity metric is that we as a county, all of our communities need to move into the orange tier together. And that is why we will be doubling down our efforts, making sure that the 21 neighborhoods that the state has identified will have that access to testing, that access to social supports, especially during the COVID-19 pandemic.
You know, the other thing I'd add too, Laura, is that I think the experience that New York City is going through right now demonstrates that if there are pockets of the virus that remain, or if there are behaviors that are persisting in places within communities, that those are urgent opportunities for the virus to reignite and to spread across the entire community, and that the work that they're doing in New York City to get a handle on those isolated geographic areas is a real challenge, and that informs what we're trying to do in California and what the equity metrics are trying to do as well, which is to consistently suppress the virus throughout the whole community, not rest on our laurels because the average numbers are going down. These hot spots can have potential outbreak possibilities, and we need to be diligent and focused on reducing the virus everywhere, not just on average.
Okay, thanks for that. And just going off that, is there a place on the county website, state website, where those specific census tracts in each of those cities can be viewed by the public and by the media?
Unfortunately, no, but on Tuesday, we have that map. Our team is preparing the map with all the census tracts, and so we will be sharing that on Tuesday at the board meeting.
Okay, okay, cool. And then regarding the outbreak at Santa Maria Post-Acute, are you able to share how many staff members the public health department has already allocated towards the facility to help?
I'm not privy to the exact number, but it's changing from day to day and from shift to shift. I'm just talked to the supervising nurse from our disease control team earlier this afternoon, and they're covered for right now. But it's literally a day-to-day situation where they allocate and find help. It seems a little easier from the beginning of the week, just because of the fact that some of the staff now are already through their isolation time and can come back, have recovered, and also some of the residents have already recovered. So it will become easier, but they still have a little bit of a tough time over the weekend to get covered, but they are getting a lot of help, including from the state agencies.
Laura,
Yes.
if you'd like a preview, you can go to Healthy Places Index. While if you search for the bottom 25 percentile for our county, you'll get a glimpse of what those areas might be. It's not exactly the same 21 census tracts that the state has in their methodology, but if you want a preview, you might use that tool.
Okay, great, thanks. And then just one last question. Thank you for taking all these from me. Looking at the state skilled nursing facility data center, it looks like they've confirmed 44 cumulative positive residents. So would it be more correct to go off of that number or the county number of 41?
Oh, I'm sorry to hear that. I would have to double check. The 40 is the last number that I got. I think there are 4 tests pending. That's a possibility. But
Okay.
I will double check.
Okay, all right,
Thank you, Laura. Next up, we're going to Fabiola Navarrete from Tu Tiempo Digital.
Yes, hello, good afternoon. Okay, this is for Dr. Bando Reynoso. Please, I just want to know if, now that we know that there are these neighborhoods that are in more risk, I just want to know, it came to my mind, the farmers, you know, this community. I just want to know if the Harvest Housing Program is still working.
It is still working. We have partnered with FSA, and the program has been launched, and we are now broadly advertising and outreaching both to the farm workers as well as to the growers so that everyone in the community is aware of the program.
Okay, thank you. Okay, one more question. It's about the free flu vaccination. I know that the one in Santa Maria is coming this October 13th, but I just want to know if you are planning to do another free flu vaccination campaign.
So right now, we are at San Marcos, we were in Lompoc, and we will, as you mentioned, be in Santa Maria. Beyond those 3, we have at this point, we don't have a plan on additional sites, but that's only at this time.
Okay, thank you. That's all, thank you.
Thank you. That concludes our Q&A.
Thank you for those questions. The Board of Supervisors will hear a COVID-19 update from Dr. Reynoso in the County Health Department on Tuesday, October 13th at 9 a.m. The county's newest weekly state report card results will be announced at that time. Our next press conference will be held a week from today on Friday, October 16th at 4:30 p.m. If you have any questions, please call the 211 information line. Local information on COVID-19 and services and support are available 24 hours a day, 7 days a week in multiple languages. Please continue to practice these 3 simple steps, personal steps every day. Number 1, remember to wear a face covering and stay at least 6 feet away from other people. Number 2, wash your hands thoroughly and often. Don't touch your face and disinfect surfaces. Number 3, if you feel sick, stay home, don't go to work, and isolate yourself. Call your doctor or clinic and follow their medical advice. Thank you for joining us today. Please be kind, considerate, and patient in your interactions with others. We are stronger together, safely apart.